Welcome to part 4 of our urinary system lecture. This is going to be about micturition, which is basically a fancy way of saying urinate. So now that we've learned how urine is made, we're going to go into how it's actually excreted. And this is going to match up with pages 528 through 530 of your text. Just to review, we've talked a lot about the kidneys, where the actual urine formation and the filtration of the blood plasma happens. But then once the actual urine is collected in the renal pelvis, it's going to be excreted through these ureters. So these are the tubes that lead down to the bladder, and then it's stored in the bladder until it's ready to be excreted through the urethra. Okay, let's talk a little bit more about those ureters. So first of all, they're about 25 to 30 centimeters long. So they're not that long. They just need to run from that sort of upper portion of our lower back down to our pelvis where our bladder sits. They're made of smooth muscle. You can see that in this cutaway here. If you were to cut it in half and look at it, you can see a muscle layer in there. And that's very similar to our arteries have that smooth muscle layer, also our intestines, so that they can conduct peristalsis, that sort of toothpaste squeezing movement. So it's not just gravity that causes our ureters to move urine from the kidneys to the bladder. If we were to stand on our head or lay down, we could still move urine to be stored in the bladder because of peristalsis. And they run posteriorly from that renal hilum, that's that little dip in the kidney bean shape, where all of the nerves and the blood vessels and the ureter go in and out. So they run from there down to the bladder posteriorly, so they're going to be behind all of our abdominal organs. And then once they get to the bladder, there's little valves here that shut off the entrance so that only things can go into the bladder, not back out. So that prevents backflow. So again, if we were to lay down, our urine's not all going to flow back to our kidneys. All right, then it's stored in the bladder, which is sort of a muscular sac here. It's collapsible, so when there is no urine in it, it actually collapses down and it's just made up of this triangular part, and then it can expand as it fills. Okay, when it's collapsed, it's only about 5 to 7.5 centimeters, and I don't expect you to memorize these numbers. I just want to show you how much it can change in size. When it's full, to the point that we have the urge to need to urinate, it's about 12.5 centimeters, and that holds about 500 milliliters, so half a liter of fluid. But it can stretch to almost double that if it needs to. So it can hold basically half of a soda bottle's worth of urine. The bladder is made of 3 layers of muscle, kind of like the stomach was, called the detrusor muscle. And again, this is smooth muscle. Okay, so we don't have to think about it. We don't have to think about move that muscle when we need to urinate. It just naturally, involuntarily happens. And the trigone, you're going to hear it referred to in your book and in a video that you're about to see, is this triangular shaped area. And this is outlined by the 2 entrances of the ureters. So here comes the ureters from the kidneys. They actually run behind the bladder, and they enter right here and right here. So the bladder is actually going to fill from the bottom upwards, and then this muscle will expand and stretch as it needs to, as it fills with urine. And then right here is where it exits into the urethra. One thing I just want to go back and show you is that the male anatomy is going to be a little bit different than the female. The male is going to need a longer urethra to exit the body, whereas the females can be shorter. And the male has this prostate gland wrapped around the bottom of the bladder here. Okay, and then lastly, the urethra is what actually leads to the exterior of the body. So it's a thin tube, and it's, again, made of smooth muscle. It leads from the bladder to the exterior of the body. So like we said, it's going to be shorter in females, about 3 to 4 centimeters, versus 20 centimeters for the males. And it has 2 sphincters. Okay, the first one is the internal urethral sphincter. Remember, sphincter is just a round muscle that can squeeze to close or relax to open. And this is going to be at the junction with the bladder. So right where the bladder leads out into the urethra, there's going to be a sphincter. And this is involuntary. We don't consciously control this one. And then we have an external urethral sphincter. And this is going to be at the pelvic floor. So where that urethra leaves through the bottom of the pelvic bone is going to be another sphincter, and this one we do control. We'll talk about why those are important in a minute. Okay, so how do we actually excrete our urine? Other names for this are voiding or urinating. When our bladder stretches to the point that it can sense that it's been stretched, it stimulates these stretch receptors, kind of like the opposite of what our stomach does when it's hungry. Okay? And this causes a reflex. And remember, a reflex is something that's always rapid. It has the same response every time. So it causes reflex stimulation of the bladder muscles. So now these muscles have been expanded, the stretch receptors have been stimulated, and our automatic reflex is for those muscles to then squeeze. Okay, and as that squeezing happens, the pressure builds up on the fluid or the urine that's in the bladder, and it's going to be forced past that first internal sphincter. So that sphincter is going to open up and let the urine out into the urethra. Then we have voluntary control. So up until this point, all of this is automatic. At this point, we choose whether we want to activate the external sphincter or not. So is it a good time to urinate, or do we want to wait? Okay, so this is basically the muscle that you're learning to use when you're becoming potty trained. You're learning to control that external sphincter. And then I've included a YouTube video here. I won't play it in this video so that we stay under the time limit, but if you click on this link, and I'll also put the link under the Part 4 activities, it's a pretty good demonstration of the process, and it's going to tie it into things we've learned from the nervous system. So it will talk about the actual receptors on the cells and how the message is sent. Okay, it's time to urinate. Okay, is this a good time to urinate? It's going to talk a little bit about the autonomic nervous system and the sympathetic and parasympathetic and how that controls urine. And this is one of the reasons that people who have spinal cord injuries or very bad head injuries, people who've had some problem with their central nervous system, often will urinate on themselves, because it's our autonomic nervous system that's controlling those sphincters and keeping them how they normally should be. And when you lose control of those, one of the first things that happens is you urinate. So think about what we've learned from the nervous system as you're watching this video. Okay, that's it for Part 4. Again, you should take a look at pages 528 through 530 in your textbook and look at what is listed under activities for the diagram packet.